Hello and welcome back to my channel. If this is your first time here, I'm Nurse Alyssa, and today we're going to do another Educational Friday. I'm hoping that these are going to be helping student nurses just get a better grasp, just quick, easy, no fluff way of learning a topic. So today's topic is going to be the difference between peripheral arterial disease and peripheral venous disease. So let's get started, guys. So we're going to start off with peripheral arterial disease. So what is it? It's narrowing of the arteries that interrupts blood flow away from the heart. So there's not enough oxygen to the leg. Now, what are the signs and symptoms? We can use pain to look at the symptoms. So P for pressure increase. So this is your blood pressure will be increased. You have an absence of hair on the legs, so you won't see much hair on the legs. Intermittent claudication, very light or no palpable pulse, and the skin feels cool to touch. Now, what are the treatments? Antiplatelets, this will decrease blood clots. Statins to decrease cholesterol. ACE inhibitors to decrease blood pressure. A low-fat diet and exercise, and to stop smoking. Now, ulcers are often associated with peripheral arterial disease and venous disease. Now, there is a difference when you're looking at them. So when you're looking at peripheral arterial disease, these ulcers will look punched out and they'll be circles. So it has a punched out appearance with defined round edges, as you can see here in the picture. So next we're going to be looking at peripheral vascular disease. So what is it? So it's narrowing of the veins that interrupts blood flow back to the heart. So you're going to have pooling of the blood in the leg. So you'll see this through edema. What are the signs and symptoms? We're going to have warm brown extremities, itchy skin. This often happens with prolonged standing or sitting. So people with careers where they're standing all day or have to sit in a chair all day, you'll see edema, and they may have a dull ache in their legs. Now, what are the treatments for peripheral vascular disease? Anticoagulants, once again, to decrease blood clots. Statins to decrease cholesterol. Thrombolytics to dissolve clot. Compression stockings, and to elevate the legs regularly. Both compression stockings and elevating the legs will reduce edema, and it helps the blood flow back up to the heart, okay? Because when we have them dangling, it's really hard for the blood to get back to the heart. Now, if we help it, if we elevate it, it allows the blood flow to go back upwards towards the heart. So with peripheral vascular disease, we want to raise the legs, and peripheral arterial disease, we want to dangle the leg. So if you look at this, an A looks like two dangling legs down. And if you look at the V in peripheral vascular disease, two legs upwards, okay? So we want to raise our legs for venous disease, and arterial disease, we want to lower our limbs. Now, with peripheral vascular disease, so veins, we also can have ulcers form because of this. Now, the ulcers do look completely different than the arterial ulcers. So venous ulcers are irregular in shape. You'll have a lot of drainage. It will be a pink wound, and there's usually brown tinge to the peri wound. Okay, so on the good skin of the leg, it'll look brown. So that's the difference between peripheral arterial disease and peripheral vascular disease. I hope this did help you, but that's all I have for this video, guys, and I hope to catch you in my next one. Bye for now.